Let's get into trying to prep up on some of the anti-March for Medicare for All talking points. Because when you're talking to your family, trying to convince them to join you at these marches tomorrow, you're probably going to deal with family members who are going to tell you some mainstream propaganda talking points as a point of reasoning that Medicare for All is bad. So this right here is a couple of economists pointing out what critics of Medicare and Gabriel Zuckman first off challenged the massive tax increase for the middle class, which is very much in line with your establishment Democrat talking point. First off, this universal healthcare assurance through taxes would lead to a large tax cut for the vast majority of workers. And you know what else it would lead to? It's going to free up employers a way to give their employees a different form of benefits from their jobs as well. You look right now, we've got a lot of people who are holding out from joining the workforce. And a great way to get those people involved and back on board is by making sure that their pay gets increased. And also when the people as a whole get their taxes cut, you know what? Even if wages stay stagnant, you're taking home a larger portion of, you're losing less of your money due to taxes on each paycheck. And and you can't underrate the value of that, especially when you're also going to have to no longer have to worry about deductions from your paycheck due to healthcare. And yes, the problem with that is this for-profit healthcare system, it's very much tied to how generous your employer is willing to be with the amount that they'll provide towards your health plan. I don't know the exact total impact that it would have, but I imagine this is something that could help you at least bring home about an extra $100 a paycheck, just with the lower taxes and no longer having healthcare be deducted from each check. So that would be my estimation, somewhere around $100 extra you'll take home, depending on your hourly wage. Next part is insurance premiums are the most regressive possible type of tax, a poll tax. The secretary pays the same amount as the executive. Sayes and Zuckman wrote, proposals such as Medicare for All would replace the current privatized poll tax by taxes based on ability to pay. Some believed that it would result in a big tax increase for the middle class. As it would lead to a vast income gain from the vast majority of workers. As I said before, you've either got the chance to get that gain by not having by eliminating employers being on the hook for your health care. And it's possible that employers could also pass it on to you in the form of being able to offer employees higher wages, which is part of the stuff that the left has been demanding for a while. And here's an example of that. Take the case of a secretary earning $50,000 in wage and currently contributing $15,000 through her employer to an insurance company. With universal health insurance, her wage would rise to $65,000, her full labor compensation, with an income tax of 6%, if applied to a base large enough, would be enough to fund universal health insurance. She would have to pay about $4,000 more in tax, but the net gain would be enormous. $11,000. Instead of taking home $50,000, the secretary would take home $61,000. So that's a great example of it right there. The way that the way that the taxes would get distributed would change, but that person would still get to bring home more money at the end of the year. With smart taxes such as broad income, exempting low wages and retirees, it is possible to make the vast majority of the population win from a transition to universal health insurance. Industry bankrolled presidents have spent months reciting GOP talking points, claiming that it would raise middle-class taxes, but as of this morning, those wildly dishonest claims have been debunked by renowned economists. So the main point here is people are going to save tons of money because part of their money will no longer be sucked up by the private health care insurance companies. Robert C. Hockett, a Cornell University professor who has also advised Warren and Sanders, said he urged Warren's team to propose financing Medicare for All in part, a public premium that would function similarly to a tax. Under this idea, Warren would propose raising revenue for Medicare for All fund under a premium charge that would go to the government rather than a private insurance company. Robert Pollin, an economist at the University of Massachusetts Amherst and author of a 2018 study that found Medicare for All would save the United States $5.1 trillion over 10 years. And there are certain studies that report even higher savings than that. 2/3 of the single-payer program can be funded by redirecting existing government health care spending from Medicare, Medicaid, and the Department of Foreign Affairs. Pollin emphasized to the Post that the funding of Medicare for All very simple. It drives me nuts when people say this is so complicated, but it's not. It's easy to pay for something that costs less. So remember, that's going to be I think that talking point is really going to help get more people on board with trying to get some skeptics over to Medicare for All. So right here is an article written back in January of 2020 by Ben Burgess, who, by the way, is indifferent to this march. That doesn't take away from certain arguments that he has made here to debunk some of these bad arguments. The first one being the life expectancy differences between the United States and countries with socialized systems are the result of less healthy lifestyles in the United States. So here's the first part here. The issue at hand is the fact that healthcare is vastly impacted by money. So if people could exercise more regularly, if, for example, they didn't have such severe asthma, or if they're not in fear of an injury from physical activity. But let's be real here. If you break your ankle playing basketball, and that puts you out of work for like 4 to 6 months, think about the drop in income that you're going to deal with during that time you're gone due to injury, with also the looming cost for surgery and visit. And this is another part. If people are able to bring home more money in their paycheck, maybe they'll be able to afford more better quality vegetables if they didn't have to see much of their money sucked up by prescription drugs, doctor visits, and the deductions from your paycheck. And when you see that certain countries just aren't that much different lifestyle-wise than the United States. I mean, there's still, as Ben points out here, there's still as much beer-loving and hockey-loving Canadians, if not more than Americans. Then the fact that the IFA deaths, the difference is about 1 to 1.5 when in comparison to Canada and British. And that babies are pretty much don't have any. Babies generally don't get obese. This is slightly surprising. Americans on average drink less than citizens of other developed countries. and British actually smoke more. Now here's the main issue here. This is the number of people who could have been saved by timely medical intervention. 78 per 100,000 people in Canada, 85 in the UK, and 112 in the United States. That's a staggering difference here. That means potentially saving 30 to 40% more lives by getting your numbers down in the Canada and UK range. In fact, about 30 to 40% of lives that were lost to COVID could have been saved if we had had Medicare for All. Next, medical innovation will suffer without market incentives. Alright, now this is the important part. In their excellent book, People's Republic of Walmart, Lee Phillips and Michael Rochford point out that more than 3/4 of really new drugs, MNEs, new molecular entities, are already developed in government labs. The most profitable and hence most common drugs that they can then patent. When it comes to one of the most important kinds of medical research, the development of new antibiotics. The picture painted by Phillips and Rochford is extremely disturbing. Amid a growing crisis of antimicrobial resistance in which microbial evolution is defeating antibiotic after antibiotic, and patients are dying routinely from routine infections, pharmaceutical companies have all but given up research into new families of the life-saving drugs simply because they are not profitable enough. So that's a major problem right there, is when your for-profit healthcare system can abandon doing things to improve the health of your people, that's a major problem. When your profit is motivated based on when your motivation is profit, then you're always going to leave someone out of the fold who could potentially use your help. But this alternative was the only one left to the doctors of Antonio Ricci of Seattle when they surgically removed part of his leg following repeated infections from drug-resistant bacteria acquired in a train accident in India that could not be treated even with highly toxic last-resort antibiotics. Each time the infection returned, more and more of the leg had to be cut off, although reappearance of bugs that cannot be fought. As a 2008 call to arms from the Infectious Diseases Society of America put it, Antibiotics are less desirable than other drugs to drug companies and venture capitalists because they are more effective than other drugs. That last point may sound counterintuitive. Effective drugs were the most profitable to manufacture. As it turns out, they wouldn't, no matter how much they gouged patients and their insurance companies for a few weeks of simply supply of antibiotics that will, if effective, never need to be used again. The drug companies will make less money off sales than they will off drugs that patients have continued to use over long periods of time. If you're concerned about the state of medical research, the best option isn't to preserve a free market in health insurance. It's to go step beyond single-payer insurance and nationalize the pharmaceutical industry so future research can be directed towards our most urgent needs. We do not have an argument against Medicare for All here. What we have, in fact, is an argument that we need new colossal public investment in the development of new treatments. We shouldn't accept the false trade-off between innovation and the right to healthcare. The only moral acceptable system is one that could do both. Next argument. Socialization means that healthcare will be rationed by a cold and heartless bureaucracy. So by this argument, every healthcare system possible involves rationing. The United States form of rationing healthcare is done by means testing it to where certain people can afford it. And when you're a more privileged person in this society, you make the choice that it's fine for you because you do not have the issue of not being able to afford urgent treatment. With socialized healthcare, everyone receives a minimum standard of care, whereas now only those who can afford to. But if rationing means what it sounds like, in other words, it carries a connotation of miserably rationing out extremely scarce resources, then well-funded national health insurance systems shouldn't involve rationing. And a good example of this is the endlessly growing military budget, which I believe Senate just agreed to another vote for like approximately another $40 billion to add to that budget. But no one would normally describe America's lavishly well-funded military as having to ration out guns and bullets. If there, one thing about weaponry is that there's generally well more weapons than people. Kind of like how there's way more housing than people. I believe it's like around 20 to 30 houses for every person in this country. If we stick to this first sense of rationing, we can see how strange the rationing complaint is by thinking of other potentially life-saving services. Fire departments don't have unlimited resources either. If too many fires start at the same time, they might not be able to put them all out. Now imagine if we had a system with which most people weren't eligible for government-sponsored protection. When there weren't enough fire trucks to put out all the fires in a given city, the people who could afford to pay top dollar for a really good fire insurance plan would have the best chances of having a truck come out to put the fire out their homes. We can argue about whether this is accurately described form of rationing, I hope we can agree it's just the least fair and least reasonable way possible of determining where to send a limited amount of fire trucks. Then the next part is, letting the chips fall where they may in a free market isn't as bad as empowering individual gatekeepers to make those decisions. And that's the reality of what our for-profit healthcare system is now. You've got people gatekeeping as politicians, and it comes down in the form of corporations get to gate, and employers are the lower level gatekeepers. And sometimes you got states have various forms of gatekeeping and when it comes to this as well. But here's the thing, if you have private insurance, abstract market forces aren't denying your claim. That's being done by individual gatekeepers who work for your insurance company. Yes, a critic might reply, but I can change my private healthcare insurance if I dislike my individual gatekeepers, whereas the government, which I'm stuck. But the wonderful thing about living in a democracy, which our fictitious critic forgets, is we can choose our individual gatekeepers if you're unhappy about the way the healthcare system is being run. You have a right to vote out people who are overseeing it. In fact, Medicare For All system affords people more choice. And that's probably the weakest argument that any anti-Medicare For All can have when they try to tell you that you'll lose your private employer health care. The facts are you wouldn't need that choice anymore. And in Medicare For All, whichever doctor you're seeing and that you like, you would be able to continue seeing under Medicare For All. And yes, if your goal is to minimize the number of bureaucrats in the system, then you should support Medicare For All. The insurance companies have market incentives that deny coverage wherever this is possible. Where socialized systems sometimes have to make decisions where they hit the limits of their resources, coverage rules tend to be far simpler, more standardized, fewer bureaucrats required. Another common argument against Medicare For All is that most administrators at insurance companies would become redundant, where we're supposed to sympathize with such people, they're administrators. We're supposed to hate them, they're bureaucrats. And in any case, Matt Brunig explains, they'll be fine under Medicare For All. Meanwhile, they're far less likely to ever talk about healthcare with anyone who isn't a doctor or a nurse. Oh yeah, this goes into the point I was making towards the end of number 3. Most people like their private healthcare insurance. Forcing everyone on a Medicare For All violates their choice. And yes, it is possible to find doctors you like under the healthcare insurance your employer offers. But with Medicare For All, you won't have to worry about being out of plan ever again. In fact, the only way to go out of plan is to leave the country. But come on, Are there really human beings who are personally emotionally attached to the rent-sinking financial entity that gets between them and their doctor? And they use a lot of misleading surveys to prove that point. One problem with interpreting this is as satisfied as wants to continue to be privately insured rather than publicly insured is that there are also plenty of surveys showing majority support. And in fact, you've got about, 69 to 72% of people in the country who are in support of Medicare for All. And yes, that includes more than half of the Republicans. That's a pretty compelling reason to think what should be obvious in any case, that most survey respondents take "I'm satisfied with what I have" to mean I don't really research to a different private insurance company or lose the amount of coverage I currently have. What people really care about is not losing coverage, not keeping a particular corporation in charge of it. And it's misleading as well. Losing implies that people will have less insurance after Medicare for All. If anything, it's increasing their coverage. And what you notice is Canadians have supplemental private insurance as well. It's illegal to charge insurance customers for duplicate coverage of what's already covered by the public plan. As I've argued elsewhere, such a public monopoly on at least basic insurance is a positive good in terms of both cost control and avoiding unjust two-tier system, but doesn't it violate freedom of choice? In a limited sense, perhaps, in that people do not have a particular choice they used to have. Anytime you make it illegal to sell something, you've limited consumers' choices, and so far they no longer have the option of buying such a thing. All sorts of health and safety regulations quite legitimately limit our choices this way. So would Medicare for All. It doesn't follow, however, that instituting Medicare for All would represent a net deduction rather than a net increase in most people's personal autonomy and freedom of choice. Think about people who don't quit jobs they hate because they don't want to lose their employer-based insurance, or for that matter, spouses who don't leave bad or even abusive marriages because they don't want to lose the insurance through their spouses. Those situations strike me as more important restrictions on people's ability in practice to live their lives in whatever way they choose than taking away their ability to choose between Aetna and Blue Cross Shield, especially when we pause to consider that those decisions are actually made by our employers. But don't employees choose their employers? Sort of. Sometimes your insurance plans change after you've been hired, and you desperately need a job and will settle for one with inadequate health insurance. If you've already committed to meaningfully expanding freedom in American society, then it's crucial you support decoupling health care from employment so that every person in this country gets the care they need, independent of their employment, marriage, and any other irrelevant factor. It's hard to say something that violates freedom of choice when it ends up giving you more choice over your life. More choice of doctors, more choice of employers, more choice over how to use the money you save in healthcare cost. And as we get into arguments over the job market, because you're going to see people who are arguing that people are getting too much money on unemployment, and that's a reasoning why people won't go back to work. Well, other people see it as, well, if you increase your wages, then you're going to open up the amount of people who are going to apply to your jobs. And my thing is here is if you really are serious about helping people return to work, then you got to be for Medicare for All. Because as I said, it's going to free up more money on your paycheck that you're not losing to taxes and health care deductions. Then when employers don't have to use part of their money to cover part of employer-based healthcare insurance, that means they've got the opportunity to pass it down in the form of new benefits, such as allowing you increased wages. Now the next argument, the Veterans Health Administration is a mess. Why would Medicare for All be any better? There's considerable dispute about the degree which the VA is or isn't a mess. The Medicare for All critics who note Americans with private plans tell pollsters they're satisfied with their insurance never seem to want to talk about that Medicare and Medicaid recipients are even more likely to report being satisfied. Moreover, the groups that are most likely to report being satisfied are veterans and active duty servicemen who get their health care at government-run hospitals. They are certainly well-known VA horror stories. Defenders of the program argue that unrepresentative cases that are hyped up by those who want to use them as a pretext for privatization. I'm sure there's some truth to that, but that doesn't mean the stories themselves aren't real. The VA is often severely underfunded by the same politicians who vote for never-ending wars in the first place. Just keep in mind that if you're still hung up on how we can pay for Medicare for All, you know what's going to help a lot in a big way? Cutting the military spending by at least 50%, if not more. That alone will easily take care of Medicare for All. And don't forget, federal police funding. I'm sure is also an obstacle that makes it harder to get the idea of Medicare for All off the ground. Let's assume the worst. Here's an obvious follow-up question. Britain's national healthcare system is basically the VA for all, yet far from being a mess. It delivers far better health outcomes than America's mostly private system. It's nationally beloved for obvious reasons. In fact, it's so popular that even British conservatives have to at least pretend to support maintaining NHS. If they didn't, they never win another election. And that's just an example of how far right the Overton window is here in the United States. It's the fact that Democrats are more right-wing on the issues of healthcare than your right-wing parties in Britain. Yes, that's right. The Democratic Party as a whole is more to the right than the major conservative parties in the UK. Citizens of the UK may have odd habits like drinking lukewarm beer, but I'm fairly certain that what they want from doctors when they get sick is pretty similar to what Americans want under the same circumstances. And remember, Brits live longer, have lower infant mortality, and lower mortality amenable to healthcare than Americans. Their VA for all system works well. So what's the difference? Less than 0.5% of all Americans are military veterans. You can underfund the VA without most people noticing. You can build a far more powerful political coalition to defend the funding of levels of a universal system like Britain's NHS or the Medicare For All system socialists want to institute in this country. And I got to point out an example. Republicans often try to portray themselves as the party of veterans. But when you see how much members of the military don't get the true help that they need after coming back from serving their tours, such as the trauma that they go and the stress that they have brought home, in addition to them becoming homeless and still having issues with getting the ideal health income due to how underfunded the system is. It just goes to show, like, the way Democrats take black voters for granted, Republicans do the same with veterans. The problems with the VA are not inherent to government-run healthcare. The success of government health care around the world shows that problems are a result of how you run the system rather than whether it's private or public. In fact, the VA shows that all we need is to make our demands more comprehensive, not just a public system, but a better public system. So another thing to keep in mind going into tomorrow's marches is that a lot of people who are speaking and supporting these March for Medicare for All events do not want Medicare for All to be the end game. We would like it to be a step to a system like NHS, more in line with like Australian healthcare, although Britain's NHS is pretty good as well. That's the next step. Medicare for All is the first step to NHS, but by no means is it the stopping point for many of us here. Obamacare shows that government getting involved in healthcare makes it worse. Whatever general problem you have in the U.S. are the result of not having a truly free market in healthcare. The answer is less government, not more. There's always a fallacy with these libertarian right arguments. It's the fact that they always argue in favor of making a system more private rather than making it truly more free. The first problem with this argument is Obamacare made some marginal improvements, such as Medicaid expansion and the fact that more people at least have the potential for access. Even with the valid criticisms of the system becoming less affordable and losing the ability to, and also the tax deductions if you're not enrolled into private healthcare insurance is another issue with the system as well. Obama critics are right about it becoming less affordable, but that was already happening before Obamacare was passed. And here's the argument that I think that the left gets as a whole is Obamacare really hasn't fixed most of the problems with this healthcare system. All they've done is get more people, like through a gate, to be consumers to this system rather than true coverage. That is certainly true, but it gives us no reason to whatever think a totally different type of government intervention wouldn't be able to do that. Just as it doesn't follow through on Chihuahuas are dogs and Greyhounds are dogs, and that Chihuahuas would be just as good as racing as Greyhounds. But it doesn't follow the premises that Obamacare is a government program and Medicare for All would be a government program. And that Medicare for All would be just as effective as solving the problems of our healthcare system as Obamacare. You know what's more like Medicare for All than Obamacare? Canada's universal Medicare program. Differences is Bernie Sanders' bill that he had would cover dental care, which the Canadian system leaves out. Although the Social Democratic Party, the NDP, has been campaigning on extending that and a few other gaps. However, it doesn't make sense to use failures of other failed government healthcare programs to justify not trying a better program. You can argue some hypothetical free market solution would work better than either Canada's government-run system or our insufficiently free market healthcare system, but if you want to convince anyone, it would be nice if you point to some real-world examples. The fact is, there just aren't any. Libertarians sometimes bring up Singapore. They shouldn't. Well, the Singaporean system is closer to a hardcore version of Obamacare than it is the single-payer model. It is still further from the unregulated health insurance market that we have. Imagine I use that argument to explain away all the issues that led to the collapse of the USSR. Sure, the Soviet economy had a lot of problems, but that's because it wasn't really full communism. They still used money, for example. I'm confident if they had gone even further in the direction of a completely planned economy, further than any other real country in history has ever gone, it would have worked really well. The way it sounds like to you, conservative reader, is the way a truly free market would solve everything sounds to the rest of us. Then the last and final one here, doctors won't work for Medicare rates. If we adopted Medicare for All, we'd end up with doctor shortages and wait times like they have in Canada and the UK. This point is often exaggerated. However, there are longer wait times. In the age of 3-second Google searches, however, no one has any excuse for believing that socialized health systems suffer from doctor shortages. Canada and US have the same percent of physicians per capita, 2.6. British have a rate of 2.8. And the highest rate in the world is in Cuba, 8.2. Yes, that same Cuba that you've got establishment political people arguing is being a dictatorship to their own country, however, refuse to lift the embargo. And at the same time, the Cuba doctors are also the most traveled in the world due to their system breeding a high amount of creation of doctors. There's more patients in a socialized health systems due to the fact that more people are able to improve. You take advantage of taking care of themselves. Free college would help more people become doctors without burying themselves in student debt. And if we had a better immigration system, it would be easier to bring more doctors in from other countries, such as Cuba, if for some reason we ever get a smart politician who would be willing to, do the right thing and lift the embargo and allow them the right to self-determination. That sounds like a pretty good way to improve your relations and help improve doctors. And in addition to that, I don't get how some of the markets that we have where we are in most of need of workers to join, that being jobs and green energy, infrastructure, and healthcare, but we also make it extremely hard to break into those markets. So that would be another thing that needs to we need to go forward with not only Medicare for All, but making it easier for more people to become doctors. Make it easier for more people to get jobs, green jobs. Get more people working in infrastructure. If the issue were that Canadians are dying in droves while they wait for specialist appointments, there would be a serious objection to Medicare for All. But we already established that. Canada has a much lower rate of mortality amenable to healthcare than the United States. Anyone who knows this, but still objects to Medicare for All on the basis of wait times is in essence expressing a concern that the lines will be longer because more people will be allowed to stand in them. Worse yet, everyone will be standing in the same line. If America gets Medicare for All, upper income Canadians can't even go to the United States to buy their way to the head of the line. A different way of putting all this, basic fairness will have been achieved. Let's do that. Opponents for Medicare for All will throw whatever talking points they can think of. The more Americans hear about single-payer health care, the more the insurance company will viciously fight back with half-baked arguments designed to scare people into thinking Medicare for All will mean worse, more expensive coverage than better, cheaper coverage. We have to be prepared. We need to understand these arguments for Medicare for All and be able to show why they don't hold up. The case for policy is straightforward and powerful, but people are also frightened by industry talking points. They need not be, though. Medicare for All is a good idea that will improve our lives, make us healthier and happier. And yes, that was a very comprehensive article from Ben Burgess. And not only do these arguments will continue to hold up, some of them will hold up even better now. If you didn't want to hear it from a political nerd like Ben Burgess, let's hear from some doctors now. First myth we've already discussed is that they would lose their private healthcare insurance. As we said before, even the doctors will acknowledge that once you take away the private middleman, you got the access to any doctor you want. No out-of-pocket costs, no co-pays, no deductibles, no surprise billing or risk of medical bankruptcy. And that's the main reason how no reasonable person could ever defend a for-profit healthcare system. Even if you're more privileged, and that's why you're in opposition of this direct action, such as Medicare for All, how could you not be at risk for medical bankruptcy? Hey, you may be closer to $100,000 per year, but you're still not out of the clear when it comes to medical bankruptcy. And taxes will go up. Yes, Medicare for All will be paid by progressive tax and possibly other taxes on the wealthy and financial transactions. For the vast majority, their costs will drop significantly. And here's a more in-depth number. Currently, health insurance costs the average family of four over $12,000 a year for premiums, co-pays, and deductibles. These will be replaced by an equitable tax based on income, and most people will wind up paying far less in new taxes than they are currently paying their healthcare cost. We can't afford it. If anything, we can't afford not to go to transition to a system like Medicare for All. Especially if you're a deficit hawk, you cannot justify how we continuously spend more and more money each year on private healthcare insurance when, if you were a principled fiscal conservative, you would realize that Medicare for All would save multiple trillions of dollars over a 10-year period. Myth number 4, it's too disruptive. Changes in employment or marital status reaching age 26 or increased income above eligibility thresholds for Medicaid or other or exchange subsidies currently disrupt coverage for needed care. Improved Medicare for All is a cradle to grave coverage each of us can afford. Having no cost at time of service is important to avoid disruptions. Medicare for All is actually less disruptive. we need to take smaller, safer steps. Incremental steps such as Medicaid or Medicare public option have been proposed by several Democratic candidates. Yet it is putting a band-aid on a dirty, infected wound and won't solve our healthcare problems. For-profit insurance companies collude with the drug and large hospital corporations, creating the extreme costs for healthcare and gaps that are so prevalent in our country. If we continue private healthcare with the public option, two problems emerge. We won't get the savings we can get from eliminating private insurance, and the private insurance companies will cherry pick the healthier people, and the public option will not survive. The improved Medicare for All legislation includes vision, dental, hearing, mental health, and long-term care. It will eliminate the burden of premium, deductibles, and copays so no one would ever have to choose between paying their bills and going to the doctor. Medical bankruptcy will be a thing of the past. So, the last myth. This is going to be an obstacle that I think will mainly pertain to your liberals who got propagandized against the idea of Medicare for All, especially when you had Pete Buttigieg, who proposed Medicare for All who want it, which is a fancy dressing of the public option which Joe Biden ran on. And why we have to use this myth on liberals, it's because some of them legitimately believed in the Medicare for All talking points, anti-talking points that they'll give in defense of the private insurance companies. And we have to explain how illogical that is. I think I summed it up pretty well for everyone. I will be in person at the Denver March tomorrow. I will probably... I've heard that you need 1,000 subscribers in order to stream live through YouTube. So I'm not sure if that's true or not, but we'll see. But I will be streaming on either YouTube or Twitch. Either way, those platforms, I will be live. Thank you for following, Dylan. I don't think I would have time to... I don't have time to do a reaction to that K-pop group, as I'm getting to the closing part of my show for today. So I'm going to go through some of these speakers that we have lined up for Denver. They don't have the name recognition of people in Washington, New York, or LA, but it's important to do this. So this is the most recent speaker announced. Her name is Ellie Spahn. She's a progressive that ran in South Dakota, and she was part of supporting Bernie Sanders' campaign. And this speaker is Bev Wasserman, a registered nurse, public health nurse. Another person that we don't know a lot about. And I did miss some of these speaker announcements, so I missed the opportunity to try to reach out to some of these speakers. However, one of the goals is to try to interview some people on the ground tomorrow at this event. Then we have MD Madeline Jacobs. So, another healthcare professional. You remember how Miami Jeff said that you needed professionals? This march is getting plenty of them. Then for those of you who are able to, after the event in Denver, there will be a sign waving event in the Pearl Street Mall in Boulder. For those who are able to get there. Then this last announced speaker is Jen Bigham, who's going to provide a personal story about her experience with the private healthcare industry. So those are the 4 speakers announced for now. I suspect that there will be more speakers unannounced because what I've learned from organizers is they've had to, due to the backlash that some of them have gotten from these bad faith attacks, from the infiltration from the Nazi prank that took place like 3 weeks ago, and their continued attacks on some of the speakers in other cities such as Jimmy Dore, Fiora Isabel, and Craig Pasta Jardula, for example, and Tara Reid. Especially the LA speakers have gotten some backlash here, is because of what you're seeing is the so-called progressives who think it's bad to fight for health care unless the circumstances are completely perfect. Just know there will never be perfect circumstances to fight for Medicare for All. And that your smears by association, just because some people speaking at these events aren't in solidarity with your politics, that's a bunch of bullshit here. And that's why I'm not for it. That's why I'm for those bad faith smears and attacks when this is a big moment in the case of direct action. So let's show the list of the cities that we have actions planned at. So it was a great job of organizing this event by one of the top organizers was Sharif Shuggs. Savage Joy was another one of the top organizers for this event. So I commend them for the work they have done to manage to get it to this many cities. Cities including Albuquerque, Atlanta, Austin, Bemidji, Minnesota, Bend, Oregon, Hampton, New York, Birmingham, Boston, Boulder, Bridgeport, Chicago, Columbus, Corvallis, Oregon, Denver, Des Moines, Detroit, Elgin, Illinois, Fayetteville, Fountain Valley, California, Greensboro, North Carolina, Honolulu, Huntsville, Alabama, Irvine, California, Juneau, Kansas City, Las Vegas, Little Rock, LA, Louisville, Madison, Wisconsin, Manchester, New Hampshire, Medford, Oregon, Milwaukee, Montgomery, Nashville, New York, Newark, Olympia, Washington, Omaha, Orlando, Philadelphia, Phoenix, Pittsburgh, Portland, Maine, Reno, Rochester, Salida, Colorado, Salt Lake City, San Diego, San Francisco, Seattle, Silva, North Carolina, Tallahassee, Tampa, Washington, D.C. So what you'll